For me, the thing that really gets me out of bed in the morning when it comes to my research is knowing that it might have an impact and improve health and well-being. I work in evidence-based healthcare. That includes helping people stop smoking on weight management, diet and physical activity, and on long-term conditions, including diabetes and asthma. And I'm based at the Nuffield Department of Primary Care Health Sciences. In this project, we're working on the policy challenge around e-cigarettes. So e-cigarettes are a relatively new development, and they create a lot of policy challenges in terms of how to regulate them. On one hand, we have evidence suggesting that they're a way to help people quit smoking. We know that they're less harmful than smoking, but not completely risk-free. But at the same time, policymakers are thinking about how to make sure they're targeting that group while not encouraging uptake amongst people who don't smoke. We're funded by Cancer Research UK to do a living systematic review looking at e-cigarettes to help people quit smoking. For this policy project, we worked with the charity Action on Smoking and Health, as well as from the government, the tobacco control leads at the Office of Health Improvement and Disparities, to review the evidence in a bit more detail on 3 particular areas when people who smoke are given e-cigarettes to help them quit. One was whether the flavors of e-cigarettes impact their use. The second was how long people keep using e-cigarettes. And the third was looking at what we call biomarkers of potential harm, so changes in measures in the blood, breath, and urine.
ASH is a small advocacy organisation. We have to work with talented researchers to be able to have that robust evidence to inform policy.
The great thing about Jamie is that she does great science, but she does fabulous communication. When Jamie has communicated her finding, you really know what it is she said.
The relationship with these policymakers is an ongoing relationship. It's been formed over years of attending the same conferences and events.
We've built trust and understanding between our organisation and her team. We can go back and forth and work out how best to communicate something. You know, how far does the evidence allow us to say a certain kind of thing? You have to build those relationships over time, but they're so important in securing change.
There aren't many researchers who can put their hand on their heart and say, my study is going to save lives by the thousands. But this is something that Jamie's research really can do. If we get this right, Jamie's research will help us save tens of thousands of lives every year.